last night we probably spent 2-3 hours trying to break down what it means to follow up with a patient. How do you know who to focus on? What triggers indicate that you should focus on them? All that sort of complexity inside of the journey, and simplify where we can take that, where we can take what parts of that need to be uniquely human, what parts of that don't need to be.
What is on one thing
that's uniquely human?
Yeah.
That's the uniquely human.
Actually, the one finding or learning that you got from that drawing process, that breaking down process.
Yeah, so maybe we have different views on this, but I think for me, my big takeaway was right now, probably 99% of the time is being spent on low value work, like low value human work, and 1% of the time is being spent on high value human work. In reality, it should be the inverse. It should be that 99% of your time is spent, or the human's time is spent on really high value patient interaction, and 1% of the time should be spent on management of the patient journey. And if you look at it that way, the bottleneck is no longer, I need like an AI agent to call 1,000 patients. No, it's actually the human could very well speak to 1,000 patients over the course of a month or 2 months if they didn't have to do anything else.
I feel like when someone hires someone for front of house, they assume that it's in their job description to handle the entire patient body, and that's what they're hired for, to manage the patient body. Do you think front of house, the role of front of house should be to manage the entire patient body from leads to recall, or do you think their time should be focused more on the patients that are coming into the clinic daily, and that's where their time and effort should be?
Yeah, so I think that this part of the clinic has become this like Frankenstein department where, and you can see it in the job ads. So if you go on a job posting website, you'll see that a receptionist role or medical secretary role has 17 parts of the job description. Patient intake, booking, lead management, patient recall, social media, supplies procurement. It's 5 jobs. And so of course, if they have all of these different things to do, then they will do none of them well. And I think that has become the reality for many clinics, is that the front of house is the place where you just do that other thing too. And so I guess to the question of what should be happening at front of house, that key point person should feel like the maître d' of the clinic experience. So when someone arrives, the front of house should give them that sense of warmth, of being welcomed, of being supported, ensuring that there are no sort of outstanding issues ahead of the actual treatment or service being provided. That is the entirety of their job. And if you think of the patient psychology, you have these really key moments around primacy and recency. So what is the sort of first experience they have when they walk in the clinic? And recency, what is the last experience that they have when they leave the clinic? And then everything that sort of happens in between is more easily forgotten. And the front of house job is to deliver a not even 5-star, 10-star first experience and final experience prior to exit. And if you actually think about what happens in a clinic right now, that is almost never the case. You've gone into a physiotherapist, a chiropractor, you've gone in to do medical aesthetics treatment, you've gone in to do a dental treatment, you have a very hands-on experience for 30 minutes, 45 minutes, and then you walk out and you have this quite low engagement, largely administrative, make a payment, nobody likes paying for anything, make a payment, and look at your calendar to think about a next appointment. All of those are low engagement activities. They're not delightful. So you're not sending someone out on a high. You're almost sending them out on a low. That's a very strange thing to do in a service-based business. If you think about something like a restaurant, you get dessert at the end, you get your free chocolate with your bill, and you're almost escorted out of the restaurant in a way that should capture the fullness of the experience. And I think that is the job. Front of house job is to deliver a 5-star in-person experience, almost as a maître d', not to play traffic control for incoming calls, not to play traffic. All of that work can be moved elsewhere in the clinic and should be moved elsewhere in the clinic. And moving elsewhere in the clinic doesn't necessarily mean hand it to AI. As soon as you make that decision, when things go wrong, it immediately comes back to the front of house. And they are then responsible for handling an inefficient system plus a hyper-efficient system that's doing the wrong things. So you need a stopgap that's not at front of house.
And okay, so my next question is around how front of house currently engages patients, it's very automated in a way that doesn't feel personal. And I feel like that's the same when they leave, they'll get a really impersonal thanks for coming in. It doesn't feel authentic. And won't get a follow-up, like most patients won't get a follow-up call. And we've seen through our work how patients react to the engagement that we send out. So they'll be really thankful and grateful for the personal touch. So do you think that front of house is engaging their patients when they exit in the correct way?
Yeah, I would say, let's go back in time, right? So let's go back before anything was automated. If a patient came in to see a practitioner, they were under that person's care. They were under that person's active care. And even though it was enormously inefficient, and it was snail mail, and it was written notes by the doctor often, the patient received something that was specific to them, and they were looked after in a way that felt very personalized and authentic to the experience that they had with the consultant or to the experience that they had with the clinic. Then automation happened, software happened, practice management software, EMR, EHR, and suddenly you could automate all these things. And that was a really exciting thing because now you could send a follow-up email or a booking confirmation email without needing to do that manually. So of course, from a workflow perspective, life got a lot easier, but it came at an enormous cost. And that cost was, we've almost lost the nuance of the patient relationship. And I think we're at this really interesting moment in time with technology where you can, in theory, get to a sort of best of breed, where you get the efficiency of automation, but you also can restore that uniquely human experience that otherwise would have been lost. So if we think about recall emails, and we do a lot of patient recall, you think about recall emails, they are the definition of efficiency at the cost of personalization, or efficiency at the cost of impact or of care. Because how could someone who hasn't been in for 3 months be the same as the next person who hasn't been in for 3 months, be the same as the next person who hasn't been in for 3 months? Just because you haven't been in for 3 months doesn't mean you should get an email that says, hey, you haven't been in 3 months. Because maybe the reason you haven't been in 3 months is that you've gone away or you've had a life event. And that contextual knowledge of the patient does not exist anywhere except for in the practitioner's mind. And it is almost never documented into the practice management software. And so you have this huge gap between I'm going to provide a personalized experience and I'm going to automate and make more efficient the way that I follow up with my patients. So today I think we're over-indexed to efficiency and we've lost a lot of that magic that can happen between a really high value practice and the patient. And that's oftentimes when you see a solo consultant or a very small practice where the practitioner knows every single patient by name, by birth, you get that sense of personal interaction. Of course, that doesn't scale. And that's where you have this issue around the business of growth versus the clinical growth that comes with it.
Okay, so you say that we're overly indexed to efficiency. Do you think that clinics are being efficient in the way that they're managing the patient body?
This is like the great joke, isn't it? It's like we've given healthcare all of these tools to make things more efficient, and yet we have not made it more efficient. This is like the great irony of healthcare. Healthcare is one of those very weird industries where technology has not brought down the cost of service. So if you look at, and there's a lot of great talks about this sort of stuff, if you look at the cost of a flat screen TV, like technology has brought that cost down over time. It used to be $1,000 to buy a flat screen TV. Now it's $100 to buy a flat screen TV. Great. Technology works. It makes it more affordable. It makes it more accessible. More people can have one. Life is good. In healthcare and in education, another great example, the same has not been true. So technology has moved into the sector or has tried to move into the sector, but the cost of providing service has still gone up. And so there's, of course, the question of if technology and efficiency are not driving cost transformation, what exactly is being automated? What are the specific things that are being automated? And is that actually delivering ROI in terms of the net value to the patient rather than just people not having to click a few extra buttons?
What tools do you think clinics don't have currently to have that perfect balance between efficiency and return on investment, high value patient care?
Yeah, this is why I think healthcare is so interesting. And this isn't a judgment of people who work in healthcare. Of course, we work in healthcare. I don't think the problem is tools. I think the problem is users. HubSpot has been around for a very long time. Very powerful CRM. Who in the clinic is going to use HubSpot? Who is the person that's going to sit there and use it the way that HubSpot meant for it to be used? So you have these healthcare organizations that have a really strong clinical team, right? The office of the MD, The office of the doctor is really well provisioned. You have strong medical secretaries. You have strong clinical intervention. You have strong healthcare outlook. The office of the COO doesn't exist. Now, if you get to a really large organization, multi-site, private hospital, you start to have a commercial department, but that commercial department still has 2 people sitting on the ground floor taking payment on a card terminal, full time. So there's this gap between I run a strong clinical provision as opposed to I run a strong business or commercial provision. And I think that gap is largely down to the user, not to the technology itself. So you can put all of the best software in the world into a practice, but if no one in the practice knows how to use it, if they're not able to extract the intelligence from that software, you have a problem because the software existing isn't good enough. You have a user problem. And we see this in a lot of our clinics right now. Inside of their own practice management software, they don't know where to find stuff. And they've used it for 10 years. So yeah, I don't know if I can pull that report. It's in there. The buttons are there. Why not just press the buttons? We can't press the buttons because the person who knows how to press the buttons is on holiday. And then when they come back from holiday, somebody else is on holiday. And oh, by the way, we have this other issue. And there's the air conditioning that went out in treatment room 3. And we have a CQC inspection next week. So who is going to sit there and be a dedicated resource to working on the business in terms of the commercial output and the throughput of the clinic? And the answer is no one. So I don't know that the issue is, let's give you more software. I think the issue is, let's pull away some of the challenges that you see at an operational level so that you don't have a what do I log into now problem. You've just got an outcomes problem. Okay, cool. Now I need to work to this outcome. Now I need to work to that outcome.
I agree with you, but I also have a question about the software. Many clinics are using CRMs and PMSs for the purpose that it's not intended for. So
totally.
When we speak to clinics about tracking recall patients or just tracking patients in general and engaging patients, they'll say, "Oh, I have a PMS that will automate send out a discount for every holiday or something." That's not the intention of having a PMS. So it's
completely category error. Yeah, I think you're right. And the way that I think there's a problem, or that you can observe very easily there's a problem. What is the first thing you see when you log into your practice management software? That is the calendar. That is the key real estate. It's like logging into your mobile banking application. The thing they show you first is your bank balance. That's why you have a bank account. They don't show you your this thing, that thing, notification. They show you your bank balance. That is the key thing that they show you. Much like in a practice management software, the key thing they show you is your calendar. Because the practice management software is designed as an efficiency tool and it's good at that. It's really good at that. But it's not designed as a patient engagement platform. It's not designed to surface your key patients. Surfacing your key patients, if we imagine what that looks like, it's logging in and seeing 3 patient names and identities highlighted and flashing in red saying, there is a problem here. So the practice management software, the entire experience is designed around the calendar, which is very helpful and necessary, but it's not about optimizing patient engagement. It's about optimizing practice efficiency. And it's in the name, practice management software, not patient relationship magic. These are 2 very different things. So I think you're right. There's a misattribution of what you can and should be doing with your practice management software. And they can stick all the bells and whistles in there that they want. And at the end of the day, the thing you come back to your PMS for is the clinical record and the calendar. Those are the key surfaces in that product, and they're very good, but they are not about managing patient engagement.
What is the association between PMS and the sales function? Because literally these are I'm talking about an egg, and is that a problem?
So I would venture a guess that the overwhelming majority of practice management software don't have a very simple capability to run a pipeline, sales pipeline. New inquiry, move them through a sequence of nurture, and then try to book them in. Those that do, and we work across certain practice management software that do have a pipeline capability, those clinics are still using a third-party pipeline tool, a generic one, not built for healthcare, but they're still using a third-party pipeline tool because the pipeline that's native to the PMS just isn't good enough. So there is no sales function built into a practice management software. And I don't know that's bad.
It's not what it's intended
It's not what it's intended to do. That's not bad. By the way, your practice management software also is not your accounting software. That's okay, because you have accounting software to do that. So there is an absence of patient engagement / revenue driven activity Sales being one big part of that, recall being one big part of that. By the way, recall is just a sales pipeline, right? It's a sales pipeline at a different part of the practice journey. So managing your patients along that journey where the next step is not a clinical step, is non-existent, it's white space. And so we work with many practices who will use a third-party tool, be it HubSpot, be it Pipedrive, and those tools are fine, but they are not healthcare specific. So you're having to total gymnastics to get your systems to talk to each other. You update something in this system, it doesn't update in that system. You don't know where your source of truth is. We've got a practice that's using 4 different tools. A very well-established big PMS that has lots of bells and whistles, Pipedrive to run their sales pipeline, Klaviyo to run their marketing stack. They have no idea what's where. So you've got cohort messaging going out here. You've got sales pipeline work going out there. You don't know who's opted in, who's opted out. You don't know who you can communicate, who you can't communicate with. You don't know who's paid you and when they've paid you. Stuff is everywhere. And so now we were talking earlier about what is the role of front of house. Suddenly the front of house's job is to manage that. 4 different systems. It is an impossible ask. It's an impossible ask for someone who's deeply technical. And it's especially an impossible ask for someone who comes up from a background in cosmetic dentistry and now, hey, you're going to run across 4 different systems and become like a data manager.
While also having to be serving...
No chance!
Yeah.
No chance. No chance.
That's the thing, is they also have their own priorities throughout the day. Like they can't be focused on
Of course.
outbound calls while also greeting and being hospitable to people coming in to the clinic and following up with them as soon as they leave. That's impossible.
No chance. Impossible. There's a practice, one of the practices that we work with, they are probably one of the highest performing practices in terms of patient follow-up. They're high performing for 2 reasons. Number 1, they're great. Number 2, because they have a system. Just having a system makes them already in the top 10%. Most clinics don't even have a system. So now you've got and their system, by the way, for a very long time was write things down in a book.
As one does.
Turns out that works. If you go into that practice and you say, hey, who do we need to follow up with today? They can say it's right here. You walk into any other practice that has a practice management software, all of the efficiency in the world. You say, hey, who are we following up with today? Who is in an urgent state that needs our attention? Don't even know where to look. I don't know who, I don't know how, I don't know if it's my responsibility. This is the other thing that's absolutely confusing, is that in front of house, it is a circus. It is musical chairs of people moving in and out. You've got people coming in for an afternoon shift on a Saturday. You've got people coming in an early morning shift on a Wednesday. You've got temp workers. So how exactly are you coordinating all of that activity? How exactly is a front of house team going to coordinate that handover? Sticky notes. Okay, if we're going to go back to sticky notes, then like we're having a totally different conversation.
I'm sure the intention to follow up with patients and know which patients require urgent attention is there from front of house.
Absolutely.
How can they possibly do so if the softwares they're using are angled towards serving those patients, and if they don't have any actual capacity in their day to personally address them and reach out to them? Like, what are they meant to do, or how can they solve it?
I think there's that great Albert Einstein quote. I'll probably butcher it, but everyone's intelligent in their own way, and if you judge a fish by its ability to climb a tree, you'll go along thinking the fish is stupid, right? Everyone has their... So in front of house at reception, you've got someone who cares deeply about service. Usually they have a background in some kind of customer-facing service environment. They've probably come up in a healthcare environment. Maybe they were a nurse or nurse practitioner or a practitioner or a consultant, and they've made a decision to go onto the administrative side. That front of house role is incredible at attracting a very certain kind of person or certain kinds of people. Those people are very good at what they do. What they do is very different than what they're being asked to do. They are incredibly good at looking after patients. They are incredibly good at handling urgent patient issues. They're incredibly good at coordinating a practitioner schedule with a patient inquiry. They're very good at that. We can't also expect that person to be your social media manager, to be your procurement specialist, to take stock, to report on no-shows, to chase outstanding payments, to complete insured billing workflows. There is a limit. There is a finite limit. It's got nothing to do with capability. It's just that there is a finite limit, and all of these processes are not defined. So when we go in and we work with a clinic, you were saying this earlier, you go in and you work with a clinic, and you say to the clinic, cool, how do you do recall right now? Write down the steps. Show me the steps. There are no steps. It's just, oh yeah, we send them this, and then that happens, and then maybe that happens. And oftentimes we will then document the SOP, the standard operating procedure, will give it back to the clinic. And it will be the first time for many of them, it will be the first time that they've actually seen their own workflow played back to them.
Which is actually crazy because they use a PMS which is meant for patient management.
It's meant, of course.
But they actually have no structure around managing their patient body.
And it's not a judgment on the PMS. The PMS is built for purpose. PMS is good, but when you make a change in your clinical protocol, very rarely is that change documented all the way back to the core system. Sometimes the core system can't even support it, right? So you might make a decision in clinic, you say, okay, when this happens, I really want to do these 3 things. The PMS can't support it, doesn't have the ability to do the second thing. So now you have to take this workflow outside of the PMS, and as soon as you've done that, which is inevitable, you start to enter the world of anarchy. You start to enter the world of, we'll just do this extra thing over here. Oh no, we'll track that into Google Sheet. And we've got practices that use very sophisticated practice management software, and if you look at their computer, you sit behind the desk with them, you've got a practice management software open, and then you've got 7 tabs of Google Sheets. By the way, all those Google Sheets are hard-coded with names and numbers. They're not building complex macros and like connecting up those sheets. This is just let me enter one thing at a time. And that's, again, not a judgment. That is the reality. That is the reality of being at the front desk.
Why did you say they would need a sales desk, clinic sales desk? Is it because of, number one is why? Is it because of clinics a special breed as a business? Because they kind of supply and demand all bundled together. Like front of house does supply and demand, right? They have to deal with marketing, sales, and then taking care of the patients. Is that the reason? And number 2 is what an ideal sales desk as a function look like, which is obviously what Coherent does, right? The why and the what.
Ask the first question again.
I should ask one. So why do you think that chaos? What was the reason that caused that chaos?
Why do you need a sales desk?
My hypothesis was because there's all bundled together. Front of house
Does everything.
Right? There's no separation. There's no purpose separation. There's no function separation. There's just one. Is that the reason, or you believe otherwise?
I think you have a few issues. The first thing is that it's just everything in one place, right? So you've got a team of 3 or 4 people, and they just do 17 different jobs over the course of a week. It's imagine being in a business and you're responsible for payroll. But now you're not just responsible for payroll. You're responsible for payroll, you're responsible for procurement, you're responsible for benefits, you're responsible for employment contracts. At a certain point, you're just like this passive vehicle for stuff to move in and around. And we always hear this from practice owners. Practice owners say, I don't know what my front of house is so busy with. What could they be doing all day? They're just sitting there. We hear this all the time. They're just sitting there. I don't understand. They're just sitting there. They're not just sitting there. They're dealing with one thing here, one thing there, a bit of this, a bit of that, a phone call on this, a phone call on that, Amazon delivery. That's what they're doing. They are a receptacle for all of these different workflows that cannot be coordinated otherwise. So that's one of the problems. The other problem is that there's no, as you said, there's no function specificity. So you've got someone who becomes this almost this like juggler of everything. That's a skill set, right? Juggling of everything, knowing what's important, what's a rubber ball, what's a glass ball, when do you drop something and it bounces, when do you drop something and it cracks. So they're very good at juggling the glass balls and the rubber balls. But it turns out that like patient follow-up, patient engagement is always a rubber ball, right? Clinical issue, my leg still hurts, glass ball, handled right away, handled efficiently. This person hasn't been in for a while. Shouldn't we follow up with this person? Rubber ball. We just don't have to do it. We'll deal with the glass balls instead. So you have this impossible prioritization issue, which hits a bit of everything, but then you have this function specialization. So the person who's juggling is not the person who's thinking about revenue. And we always have this conversation with practices about the word sales. Should you be selling in healthcare? If you have a website and you're spending on ads, you are selling. We can have that conversation all day long, but clinic owners will say, oh no, I don't want to sell. If you have a website, if you've invested in your brand, if you have invested in being found, you are selling. If you're running Google ads, if you're running PPC, if you're running SEO, everyone wants to do SEO, you're selling. You're trying to be found. So then people find you and they don't know what to do. They reach out to you. Oh, I found you. You've done all this hard work to get found. Somebody finds you. But you don't answer. They knock on your door. Hello. Nobody answers. They'll go next door. It's cool. No problem.
So that's marketing, right? So that seems to me, at least, is almost like a misunderstanding of what marketing is and what sales is.
100%.
And what is sales in healthcare?
If you think of a funnel,
Let's talk about sales desk.
let's talk about sales desk, right? So you have a funnel. At the top of that funnel, you're just trying to get people to find you. Let people know who have your problem, the problem that you solve. You're a GP, someone has your problem that you want them to find you. That's job to do, right? Of marketing. Awareness, capturing that interest, driving that inbound. But when people hit your shop front, which is more often than not a website, which by the way is a whole different problem because websites are notoriously hard for patients to navigate because they don't know what they should be looking at. They don't know what they should be reading. They don't know what's right for them. So you've done all this hard work. You spent all this time and this money. You've paid your marketing agency to do your social media posting and your SEO. You spend thousands of pounds a month. People have finally found you. They've made it to the front door. They knock on the door. That is the job of sales desk. Sales desk is the job of, how can I help you? That is the job. How can I help you? You have come here for a reason. The weird thing about healthcare is we speak to practices and they say, oh, we convert 30 to 40% of new inquiries. That number is incredible in most industries. That number is horrific in healthcare because people don't randomly reach out to a chiropractor. You reach out for a reason. You reach out to a chiropractor because you have a specific problem. Not because you're shopping around. You have a problem you want to solve. I don't go look for IVF treatment because I'm interested. I go because I have a specific reason. I have a very acute pain point. It's a very high intent interest. So the job of sales is not to convince you that you have a back problem. The job of sales desk is not to entice you into consuming something, entice you into a treatment that you don't want. The job of sales desk in healthcare is, what can I help you with? Sounds like you have a problem. How can I help you find the right thing?
That's something that Mark was saying, like when we were talking, the recourse. So when Tandy called somebody and the person was saying, oh yeah, not this, but what about this? So that guidance, that help was not just about, here's the thing, are you going to buy it or not? No, bye-bye. But instead, oh, maybe this is something like massage instead of chiro is something where you actually need, and help them to guide choosing the right path.
100%. Within that realm. So you think of an administrative conversation. An administrative conversation is, oh, you're feeling okay? Great. Let us know if you need anything. There's nothing wrong with that conversation, by the way. There's nothing wrong with it. A sales desk conversation is, so happy you're doing well. How are you feeling more generally? Oh, actually, I've got this pain in my knee. Or, oh, actually, I have this other thing. Oh, actually, I'm going away in a few months and I'm a bit worried about this. Okay, great. It sounds like you're concerned about this thing. It sounds like you're worried about that thing. Sounds like you may want to talk to someone about this other thing. Does that sound right? Yes. Okay, great. We can help you with that. Or, hey, we can't help you with that, but maybe doctor or clinic so-and-so can help you with that. So that sales desk is a discovery role. It's, what are you doing here? Hello, patient. Why have you reached out to us? Why have you expressed interest? You don't express interest in a chiropractic clinic, in a medical aesthetics clinic, in a dental clinic because you're curious. You reach out because you have a need. You've just moved to a new area. I just relocated. I just moved and I had to sign up to a new dentist. And I reached out to 5 dentists. First one that came back to me, I registered. I didn't care. They were all fine. They all had 5-star Google reviews. I sent them a note. Hi, I'm moving to the area. I'll be there in a few months. One of them wrote back first. Cool. Signed up my whole family.
So as much as it's about driving revenue within the clinic, it's also about providing white glove service to the patients.
Absolutely.
Super individualized,
Absolutely.
tailored service. That's also, it seems to be solving that problem with the software versus user, because there is no user in the clinic who's using this new software. It's all back end, plug and play.
100%.
So it's directly.
Yeah, absolutely.
Why is this? Is sales desk going to be replaced by AI? And should it? And if not, why not?
So it's a really I think there's healthcare implications across the board. I think it's very seductive to say AI receptionist, and there's no shortage of AI receptionists in the world today. Amazing AI receptionist. If you really look at the workflow, you really go deep into the workflow of something like sales desk or patient recall. You really go into the workflow. What you realize is that a huge amount of the inefficiency has absolutely nothing to do with communicating with the patient. It's not that you can't have the phone call with the patient. It's not that you can't call them to follow up. It's that you have to do all of this work to do that. You think about sitting down with 100 patients you need to call. 96 of them won't answer the phone. You have to dial the number every single time. Maybe you have an auto dialer. So you're spending
Also, how do you even know which patients to call in the first place?
And who do you even call in the first place, right? So now you've got, let's say you figured it out. So you've got a database of 1,000 people. How do you pick those 1,000 people? How do you then engage with them in an efficient way? When the patient responds, when a patient expresses interest, that's not the hard part. That's the uniquely human moment. The uniquely human moment is, how can I help you? I hear what you're looking for. We've spoken to patients who have this problem. That is an opportunity to deliver a surprise and delight moment. That's the random free Uber ride, right? That's the random free Uber ride. When a patient calls a clinic and the first thing that they hear is, hey, how are you? How can I help? And not, please hold. And not, please press 1 if you're a new patient. Please press 2 if you're an existing patient. Please press 3 if you have a clinical emergency. Please press 4. That's not, you're charging someone £500 to come see you. When did it ever become okay for the first thing that you hear on the other side of that to be, give me phone options? You know what? I call my phone provider. I get phone options. I understand I'm paying £40 a month. I get why the phone provider gives me options. Press 1 for this, press 2 for that. When I'm calling my doctor.
And you don't believe that would be doing a much better job than letting the caller to select numbers?
Absolutely. If you can put a voice AI agent in there that says, what can I help you with today? Can I route you down pathway A? Can I route you down pathway B? Oh, it sounds like you're a new patient. No problem. Let's go here. That triage of where does the patient go? Great. Phenomenal. But when you start to push into depth around that patient journey, and really importantly, when you need to connect the dots across systems, because unless that agent has contextual, interoperable knowledge across your historical communication, your inboxes, your outboxes, your practitioners' brains, and the practice management software EMR, EHR, unless it can consolidate, bring together all that information, you are ultimately working across surfaces, and you're ultimately working across broken information. And so we need to be able to close that in order to provide a high-value engagement for the patient. So maybe at some point in the future, that is reliably end-to-end AI. What I think is very possible today is rebooking someone. Oh, I'm supposed to come in on Tuesday. Can you move me to Thursday? Phenomenal use. And there's no shortage of voice AI agents that are handling that and keeping some of that noise away from the practice team. That is a different journey than driving revenue at the front desk. And at the end of the day, you're running a business. And we can debate that all day long, but if you are not running a business, you are cash flow negative, you are losing money, you can't invest in your staff. You can't invest in new procedures. You can't provide a high quality patient experience. So at the end of the day, the money is what enables you to provide a great service. There's no way around that.
It's business critical, but why do you think clinics are afraid of operating like a business?
I don't think it's fear. I really don't. I spoke to a practitioner who runs like a WeWork for doctors. It was very interesting to hear about his journey. He was a practitioner and then he set up this business, and we were talking about this. Doctors aren't good at business. I think that is nonsense. Doctors live very well. They build wonderful careers. They retire. They create intergenerational wealth. This misconception that doctors are not business people is not representative. I think what is missing, you get a lot of people who realize that there is a lack of information. There's information asymmetry. And so people will flock to the sector to exploit that information asymmetry. They'll say, oh, we have a practitioner who was charged £10,000, actual number, £10,000 to stand up a 5 or 6 page website. £10,000. That price point made sense 15 years ago. It does not make sense today because you can stand up an entire website, higher quality in probably 3 hours with an AI-generated content or CMS, like content tool. So there's this information asymmetry. And because information asymmetry exists, information asymmetry underlies, it underpins distrust. And distrust breeds disengagement. And we need to find a way to change that conversation. We need to make practitioners aware of the fact that business is not a place of sabotage and exploitation. It's a place of growth. And there's a huge opportunity, I think, to build into that. And you're seeing this with some of the new clinical entrepreneurs who are thinking about their businesses and who want to engage and upskill. But there's a huge community of practitioners who have decided that's not right for them. They've been burned too many times. I spoke with a practice not too long ago based in London. They do a combination of dentistry, medical aesthetics, very high end. Their business has unfortunately fallen off a cliff. And the question is, of course, why? And the answer is, I have no idea. Because as soon as I stick my finger in the business pond, a big fish comes and bites it off. And it's scary. It's very scary. In a similar way that for a marketer or for a salesperson or for a COO, please, could you just go in that room and conduct a quadruple bypass? I'm good, actually. I'm fine. I'm actually not the doctor. I'm not going to go and take that step into the unknown in an uncomfortable way. I'm going to go to the expert. But the expert in healthcare is very trusted. And I think in some cases, the expert in business or the expert in business services is not trusted. And that's a huge problem.
Why do you think they're not trusted? Is it because information asymmetry that they're not trusted, or is it because it's...
I think it's just cowboy land. I think it's totally Wild West. There's no... How as a clinic can you really benchmark this agency against that agency? There's no transparency. Pricing is all over the place. People charge you for whatever they think you're willing to pay. There's no consistency. It's just totally Wild West. And that's, I think, the sign of an emerging industry. It's the sign of the commercialization of an industry. Now there are more and more shifts from public to private. The gentleman who runs this We Work for Doctors, he said they want to grow their practices. Anything that they can do to leave the NHS, they'll do, which I think was a bit dramatic. But I think the point that he was making was there is a desire to explore new forms of care. That exploration is opening a new part of the market. The question is, can you serve that part of the market? And can you do that in a way that engenders trust in the community?